So stem cell therapy has been around for decades, and it's an exciting form of medicine and actually cutting edge because it's regenerative, not degenerative. So stem cells can become anything. They can become tissue, cartilage, bone, ligaments, even organs. And so they're basically like blank cells that can become anything once they're injected into the area. And there's 3 different types of stem cell therapy. Number 1 is adult stem cells. So a lot of people have heard of that because it's your own stem cells. They take either fat or bone marrow out of your hip or adipose tissue, and they take that out and then they spin it down and they re-inject it to the area that you want to inject into either a joint, your spine, shoulders, any area really. And the problem with that is that there's a high risk of infection. There's also some risks of the procedure. If it's a longer, more intensive procedure, it's more expensive and it takes longer too. So there's another form of stem cell, which is embryonic stem cell. That's the kind that is illegal in the United States, and it's the kind that we don't use and never will. And the kind that we use is called amniotic stem cell. And so those are taken from mothers who have planned C-sections, and then they've agreed to donate their placenta to science. So they'll take the cells from the placenta side where there's no antigens, so no risk of rejection. They do some extensive testing for infections and any pathogens to make sure it's nice and clean. It gets shipped to us in dry ice overnight. And it's kept at a very, very low temperature, so it's very safe. As soon as it's thawed, we inject it. It's a 15-minute procedure. The most common conditions that are used for stem cell, and what we use in our office, are osteoarthritic conditions. That's the most researched way to use stem cell. However, there are some exciting ways that stem cell are being researched and used right now for Alzheimer's, ALS, and other neurological and spinal cord injuries. Surgery always carries a huge amount of risks. 1 in 400 total knee replacements actually end in infection and or death. Over 50% of those surgeries have to go back for more surgery because those joints can wear out too. Just because they're replaced doesn't mean they last forever. So if you've been told that you have to have a surgery, or that's your only option, there may be other options for you where you could get back to your life much more quickly and without having to go under the knife and have surgery. We do free consultations at our office, so you can call and schedule, you can email us, and we'd love to see you.